So, I hear you want to know how I got to where I am today. Well, it was a long road, but I'll start out with how I found out about my purpose. In my first year of college, I participated in a CAPS test to see what careers my interests and talents would lead me towards. In the results, the job of being an MRI, or magnetic resonance imaging, technician stood out to me as my uncle was in that job and is still working in that job today after 27 years. Within a month, I applied to Dr. Phillips Hospital to begin volunteering, wanting to see how well I would perform. After I started volunteering, I realized that I enjoyed interacting with the hospital staff and its patients. I grew comfortable in amusing the people around me, and when my author was a patient and treated well, I wanted to contribute to the excellent patient services. I became highly motivated to support their high standard of care, resulting in my dedication to give back to their organization. This experience of volunteering further reinforced my passion for serving in the healthcare industry professionally. That led me to look deeper into this job to see how I could be a productive and financially secure staff member. But of course, there were other influences that helped assure me that the hospital was the place of work I would enjoy. So, as I mentioned, I took a CAPS test to make sure I was heading in the right direction. The results implied that I would perform well in fast-paced areas with social interaction, which is consistent with the job requirements of MRI technicians in the Occupational Outlook Handbook website. As such, I continued volunteering through my first year of college. Since college was more important than volunteering and expenses were building, I realized that I needed a salaried job to support myself. Still, thanks to volunteering, I realized my goal of becoming an MRI tech, leading to a fulfilling professional career that I have never regretted. So, in my quest to become a radiographer, I attended Valencia College, which was the most affordable route in completing my course requirements for my AS degree. By doing so, I was able to apply to the radiology program at Valencia, and I started going to work at the hospital as a Valencia student in training, while I took care of electives in UCF. After a couple of years toward finishing my bachelor's in radiography, I was able to apply to become an MRI technician, which brought me here so I could have the opportunity to meet you. Would you like to go over some important information about the departments as radiographers make certain that our patients are safe and comfortable? The MRI technicians work in small teams to conduct MRIs, which are basically super magnets. So always make sure there are no magnetic materials in the MRI room or on patients when they are escorted into the room. X-ray techs perform CAT or CT scans, which of course use X-radiation. So anyone in the same room as a running X-ray machine should most certainly have lead protective gear or a lead wall between them and the machine for safety purposes. Nuclear medical technicians administer radioactive drugs to the patients, which helps the images in the MRI to be well defined. Now, lastly, in every lab, the only people who are allowed to work the equipment are those who are certified to use it, such as with us having MRI ARRT certifications, in which we can only use MRI machines and equipment. So, that's my story, and again, I hope to get to know you as well. And just remember that here, we work in teams, so if you need help or have questions about work, feel free to ask any staff member in this department, and we'll do what we can to help you.